It's really. And what do we know about effects of vitamin D3 at the present moment? So numerous studies suggest that vitamin D plays an important role in the nervous systems. Such vitamins implicate in regulation of calcium, modulation of neurotrophin releasing, and of many neurotrophic factors, which are very important for memory-related process and for any affective related disorders. And such substances can modulate activity of brain genes, around especially 200 genes. At the present moment it was established, maybe it can be more and more, we don't know, because it's just recent studies, and at the present moment they are very developed. And they control enzymes of neurotransmitter metabolism. Concerning its effects, it was found that such action in the brain, in the CNS, vitamin D can realize via special vitamin D receptors. And this is a member of nuclear receptors, superfamility of ligand-activated transcriptors factors. And what we know at the present moment about possible mechanism of action vitamin D3. Now it's known that vitamin D3 can produce a genomic response. It's a usual standard mechanism for all steroid hormones, like corticosterone, like estradiol, like progesterone. It's a usual mechanism. And of course, vitamin D can connect with membrane receptors, and using such way, vitamin D can possess non-genomic effects via membrane receptors, and it's more interesting and more exciting sites for pharmacologists in order to understand how we can make therapy using such ability for vitamin D3 to modulate of any membrane receptors. And on the other hand, except role of vitamin D3 in the brain, vitamin D3 plays an important role in the female reproduction system because this vitamin controls gene expression for estrogen synthesis enzymes. And in many, for example, in many clinics, especially in Sant Petersburg, because we are living in north part of Russia, in some private clinic for in vitro fertilization, there is a special procedure when we prescribe vitamin D3 for long or short-term procedure to receive ovulation in women with perimenopausal period who wants to have a baby. So we took in mind such interaction between vitamin D3, brain, and reproductive systems, and we decided to make pilot clinical studies. We received a grant for this work from Russian Science Foundation, and now I want to present what we received. So the aim of this pilot clinical study was evaluation effects of vitamin D3 supplementation at several doses, alone or in combination with standard menopausal hormonal therapy on anxiety, depression states, estradiol, vitamin D3 and calcium levels in perimenopausal women of different age. In this presentation, I only present estradiol, vitamin D3 and calcium levels, but of course, we measured all hormonal states of such women, and if you want to ask me about this, you can come to me after presentation and we discuss it, because I cannot present all results of this big study in my short presentation. So, what we to do in these clinical studies. We use three groups of perimenopausal women of different ages. Young ladies, 33-44 years, middle age women, 45-55 years, and old women from 56 to 63 years. In each group of women were around 40-45 women, and in each subgroups of these women it was around 6-7 persons. Of course, we used a special questionnaire in order to remove women with any oncological problems from the study, with any severe gynecological problems in her life state. And of course, we cannot use women who have to take any psychotropic drugs or women with very severe depression or very severe anxiety who needs strong medical help in a special hospital, in special psychiatric hospital. It was normal, as I can say about women in a special period of their life, but with signs of perimenopausal syndrome. So, as vitamin D3, we used two different drugs. It was Vigantrol or Aquadatrim. It depends from physiological state of such women, if she prefer to take Vigantrol and she haven't any problems with your health, it's not a problem. She take Vigantrol. If no, she used Aquadatrim. And we used three different doses, 20,000, 40,000 and 80,000 international units per day of vitamin D3. And for each woman, of course, it also depends from individual peculiarities of the woman we used such drugs. This is the standard drugs which used for menopausal hormone therapy: Zoe, Femastone, 210, Clyra, Utrogestan or estrogen. And we made constant monitoring during 6 months of such therapy. What I have to say before present results. We make measures during 1 month, after such therapy 3 months, and after 6 months. In this presentation, I will present final results of this study. But of course, if you want to ask me about how it was after 1 month, after 3 months, you can do it after my speech. And what we measure? We measure depression and anxiety scores using a standard hospital scale for depression and anxiety, and we measured estradiol, 25-hydroxy vitamin D3, and calcium levels in the blood serum of such woman. And also I want to emphasize, if you want to ask me about another hormonal analysis, you can do it after, because there are a lot of such hormones, as you know, in blood of women. So what we found? First of all, I want to say that the results were very complicated, and I present on these pictures, on these slides, positive results of our study. But and as you can see in my pictures, you will see only one dose. It's improving. This is a dose which is improved and ameliorate anxiety and depression scores. You can ask me why. Why only one? Because previously I said that we used 3 different doses. It's normal questions, and I ask you now, because in the presentation I give you positive results, but we receive negative results and no any results too. And in conclusion, I talk to you that it's very important, if you take any preparation for vitamin D3, or your doctors prescribe to you any hormonal drugs, and you must combine such hormonal drugs with vitamin D3. So another doses was not effective, or it's important to produce more high level of anxiety and depression, and this is a problem because some studies from the literature can show that some women have improved anxiety and depression states, but in other studies cannot show, cannot present, cannot demonstrate that there are any effects in general, or any improving action of vitamin D3. And it depends from until the study, in previous study, there are no any classification by age for women, and there are no any specification for dose of vitamin D3.